major neurological disorders, including Parkinson's, MS, MG, and ALS. We're breaking it all down, making it simple, and packing it with memory tricks to make sure it sticks. Oh, and if you're a Simple Nursing member, be sure to grab these two study guides located in the membership area. And let's lock this information in. All right, brains on, and let's get started. Focus on the highlighted ones below, since these are the most tested. So the neurodiseases that affect the CNS, the brain and spinal cord, we have MS, Parkinson's, Alzheimer's, and Huntington's. And for those that affect the PNS, the peripheral nervous system, we have MG, ALS, and GB, that Guillain-Barré syndrome. Now a quick side note and a big test tip here. No drugs or interventions will cure these conditions. We can only treat the progression. So a key term to know is promote independence. For all progressive neurodisease patients, we teach never do all the ADLs for the client. And for gait training, we preserve independence as long as possible. So first, we always teach gait training, then offer a cane, then a walker, and then very last, a wheelchair. Now let's break these down one by one in a rapid fire sequence. First up is MS, our multiple sclerosis. So the memory trick is MS, myelin sheath destruction from that autoimmune disease where the body attacks itself, resulting in MS, muscle spasms and stiffness. Now we teach the clients to balance exercise and rest and avoid the 4 S's, which trigger flare-ups. Typically with all autoimmune diseases, anything that can irritate the body can cause an immune response. So avoid stress, like exercise, surgery, or even injury. The big one here is don't overdo exercises. So no marathons or intense workouts. The second S is for sickness and sepsis. We teach clients to stay healthy and free from infection. The third S is smoking. We use smoking cessation. And then very lastly, sun and extreme heat. So avoid the hot tub, baths, and saunas that are extremely hot. Now for pharmacology, we use IVIG, which kind of acts like bait, so the body attacks this substance instead of the nerve in autoimmune diseases. And then very lastly, cyclosporin, we call cyclosporin, since it spares the body from attacking itself with autoimmune diseases. Next up is MG, myasthenia gravis, which we call dryasthenia gravity, since the body gets really dry and weak, like loads of gravity weighing down on the muscles, causing droopy eyelids. Now, MG is also an autoimmune disease where the body attacks acetylcholine receptors. So we get less acetylcholine, so just think less secretions, and we end up with a very dry body. Now, we teach clients to also avoid the 4 S's to avoid those triggered flare-ups. And for pharmacology, we treat the dry by giving cholinergics, which add secretions to the body. So these end in stigmine like neostigmine. So just think stigmines add secretions to my body for myasthenia gravis. Now for severe MG, this is known as a myasthenic crisis. We're talking severe diaphragm weakness and respiratory arrest. So the number one goal here is airway protection. So having an intubation tray set up at the bedside is priority. And in terms of safety with swallowing, before meals, we have to give those stigmines like pyridostigmine, those anticholinesterase drugs. And then very lastly, we encourage semi-solid foods. Now for Parkinson's disease, we have low dopamine and high acetylcholine. So just think there's no dope in the park with Parkinson's. So the 3 key signs to write down, and the biggest one to know, is number 1, a shuffling gait with decreased arm swinging. Number 2 is pin rolling, where it looks like you're rolling a booger between your fingers. And then number 3 is tremors at rest. So we see a lot of jittery movements and weakness. So just think, you can't jump rope if you got low dope. So we typically see improved movement with more dopamine. So that's why we say, if you want to jump rope, well then you need more dope. Now to get more dopamine, we use the pharmacology drug levodopa and carbidopa, which leaves more dopamine in the body and carbidopa helps to conserve more dopamine. So the number one test tip to write down is avoid protein with levodopa, since it can block absorption. So the memory trick is leave the protein with levodopa. Now for Alzheimer's, just think it's all about the brain damage, resulting in dementia, that damage to the brain. So the signs and symptoms is very forgetful and loss of reality. So the key point here is to protect these clients like you would protect a child, but treat them as an adult. So for safety, we want to make sure there's no rugs and we lock everything, including medication, cleaning supplies, and everything else. And for location, we want to lock doors that are leading to the outside, since clients will get lost. Huge safety risk. And for communication, key terms here, distract and redirect from reality. Do not present reality. A lot of students get this wrong, so this is the biggest test tip for this section. Remember, these clients have damage to the brain, preventing them from understanding reality. So write this down. We need to redirect and distract any dementia clients who are getting easily frustrated. Now, Huntington disease is progressive nerve degeneration that is incurable. So the key points to know is it's passed on by genetics and it only requires one parent to pass it on. So recommend genetic counseling when someone is ready to have a baby. So just think Huntington rhymes with one. It only takes one parent to pass on the disease. Now for ALS, that amyotrophic lateral sclerosis. The memory trick for ALS, just think ALS like advanced life support. Clients typically are dead in 3 to 5 years. It's a very sad prognosis. We're talking total body paralysis that eventually leads to respiratory failure. So patients will need advanced life support, being put on a ventilator to keep them alive. So the key points to write down is dysphagia, that difficulty swallowing, dysphagia, that difficulty speaking, and a priority finding is increased respiratory secretions. Now, very lastly, GB, that Guillain-Barré syndrome. The memory trick is to think ground up berets, since clients get rapidly ascending paralysis within a few days or a few hours, starting in the legs and eventually reaching the respiratory system, which ultimately kills the patient. So think Guillain-Barrés as Guillain-Barrés. Go seek medical treatment immediately because it happens so rapidly. Now, respiratory failure, early signs and symptoms to note is the inability to cough and the inability to lift the head or eyebrows. Huge, big NCLEX tips. So write